Welcome back to the show, and we're beginning discussion on melanoma with Dr. Mark Beaty of Beaty Facial Plastic Surgery. Glad to have you back, Mark. This is summertime. Everybody's out in the sun. We're having a great time. Pollen's about over for the most part. It's always around. But, another concern that we want to bring to our listeners is that concern of skin cancer, and you're an expert on skin cancer.
Yep, that is true, and this is a big problem that we have to be particularly aware of in the summertime. Living in the South, I think this is something we really have to be aware of year-round because we have such a outdoor-oriented lifestyle, and we're fortunate to be able to have that in the Southeast. But this is a great time to talk about it.
Well, it affects almost everybody. In fact, I've even had a small skin cancer, and Vicki Locke, our executive producer, you're fair-skinned.
And my parents have both dealt with skin cancer. So is that a genetic problem I should be concerned with?
Depends on what types of skin cancer, but most skin cancers, the proclivity for them does have some genetic component. I think what we've touched on here initially is just how common skin cancers are. They are by far the most common form of cancer that we see in the United States. And just to throw some numbers out, about 2 million people in the U.S. have a new diagnosis of skin cancer every year, and that's a total number of cancers of 3.5 million. So these are huge numbers, and as Jeff alluded to, almost all of us have probably been touched by somebody who has had a skin cancer.
It's funny, really personal, but I think I have another one.
I think I might have one. I'm getting really nervous.
Hey, why are we laughing about it? Because
I know.
I do say this about skin cancers. When I see patients, and I don't mean to make light of it, because obviously something we're going to get to pretty immediately here is talking about melanoma. But generally, there are two other skin cancers, basal cell carcinoma and squamous cell carcinoma, that generally I shouldn't make as much fun of it, but I do because I've had them. And I said, if God showed up here right now and said, Jeff, you need to have a cancer, I'd say, well, I'd like a basal cell carcinoma on the skin. He'd say, no, that's not a real cancer. Yeah. You can't have that because we're going to fix that. So the upside, the silver lining is that not all skin cancers are bad as long as they're treated.
I think that is the mantra that we should keep in mind for skin cancers across the board, is that these are preventable, they're easily diagnosable, and they are treatable. But the key is to pay attention, to catch them early, and then, yes, it's a very manageable problem.
So what are the most common types of skin cancer you're seeing, Mark?
So basal cell carcinoma, by far, is the most common, and Dr. Gallups, as you referred to before, it's fairly easy to treat, and tends to be minimally invasive as long as you don't let it just stay there and not do anything about it over a long period of time. Squamous cell carcinoma is the second most common, and then the focus of our discussion, melanoma, is the least common, but also has the greatest potential for causing bigger, longer-term problems.
It's melanoma. My opinion for my listeners is that it is a real cancer. I mean, it has deadly consequences. So prevention is the number one key. So how do we diagnose it? I mean, people are going to listen and they're going to become paranoid. So, Dr. Beaty, tell us, what do we need to be looking out for?
Well, melanomas are a malignant transformation of melanin-producing or pigment-producing cells in the skin. So you are generally going to see these cancers arise in an area that's more darkly pigmented than the surrounding skin. And that is, so that's the first key, is to know what to look at, is to look at pigmented areas on your body.
So moles, anything that's an isolated colored lesion on your skin.
Indeed. These would be the things we'd suggest that you monitor. And in fact, for people who have a history of previous skin cancers or extensive sun exposure or genetic predisposition, we would recommend on areas that you cannot see easily, like your back, that you photograph those areas periodically, or have them examined by your medical professional to make sure that that those pigmented areas are actually seen.
In preventative examinations, is there any standard out there?
You know,
I mean, are you checked every 6 months, or should everybody be checked once a year, or what?
Yeah, I think that the tendency is to check people once a year. And that is the population for whom you feel there is some degree of increased risk. So again, those who maybe have primary family members who have had a previous melanoma, those who are very fair-skinned, who maybe have a higher proclivity, or those who have had an extensive amount of sun exposure.
Well, that's the key. That's the key is prevention and diagnosis and early treatment for
Yes.
it. No. Once again, we're talking to Dr. Mark Beaty of Beaty Facial Plastic Surgery, and I want to switch the discussion right now to something that's a little more positive. We need to deal with melanoma, and it is sun time, but there's got to be a silver lining here, and you are a big advocate of a new technology. Tell us about it.
Well, we have for the last year been using a technology called cool sculpting, which is a way of non-invasively and non-surgically reducing pockets of fat that may not be desirable.
No, you wanted to say something else, but that's good. But it is pockets of adipose tissue of fat, and also how does it work?
So this technology was actually developed at Harvard Medical School. It's an interesting little story how this came about. A group of doctors there noticed that there were a number of kids in their pediatric unit who developed buccal dimpling in the cheeks after eating popsicles for weeks and weeks. This apparently was a staple at the pediatric unit in Harvard. And they put this together that, hey, maybe the cold exposure had something to do with reducing the fat in these kids' cheeks. So a few studies later, it turns out that fat is much easier to freeze than skin or muscle. So yes, you can preferentially eliminate fat by applying the proper amount of cold temperature to it.
And how does that make the fat go away? Does it kill the fat cell?
That's exactly what it does. It kills the fat cells. So with each cycle of cool sculpting, what we generally see is a 25 to 30% reduction in the number of fat cells in the area treated.
Oh my God! Can you? Do you have enough seats in your office for this technique? Because I got to tell you,
I'm hearing angels.
I knew Vicky's over there smiling, and I'm wondering when she's going to say something. Because I tell you, I don't know of a lady in this community that doesn't think, "Wow, I need a little bit of that done." So, Tell us the process.
Okay, so what we do is people come in for an initial assessment. The key is finding the areas that are going to be most amenable to treatment, and there are some standard protocols for making those assessments. Once that is done, literally the treatment could be done the same day if there is time to do it. This is a no downtime process.
I saw a picture of you laying back with the device on you. I mean, you just sit there and it's like melting fat. This is like utopia. What do you think?
So, it's freezing my legs. And then they're skinny.
Legs
and then
or belly or whatever.
I am down with that today.
Yep. And really the treatment, as I have had it, all of my staff members have had it, this is something that is so non-invasive and so non-bothersome. Most people will sit and watch television, sit and do work. It's very, very easy to go through.
Wow. So tell us, Mark, how do people get in touch with you?
They simply need to call the office at Beaty Facial Plastic Surgery. That's 770-753-0053.
How about your website?
www.drbeatymd.
Excellent. So, any advice for people as they go out in the summertime right now?
Yes. Sunscreen. And we had talked about skin cancer earlier. That is the most important controllable factor that you have to help to minimize your risk of skin cancers. You should be in an SPF 30 or higher sunscreen all the time. Reapply it every 2 hours.
Excellent. Thanks for joining us.
Thank you.